I'm Torri.
I'm Kylee.
And I'm Salena, and we're going to talk to you today about stress and ways to cope.
Stress has several effects on the body. It affects the immune system by increasing the susceptibility to infection. When people are stressed, they are less likely to attend to healthy habits such as exercising and eating healthy. There's also a molecular link between stress and obesity. Some people use alcohol, drugs, and tobacco to cope with their stress. Situations of stress include marriage, childbirth, loss of a job, success in school, financial difficulties, and death.
Physical signs and symptoms of acute stress include increased heart rate and blood pressure, increased respiratory rate and depth, dilated pupils, contraction of the spleen, decreased blood clotting time, dilated bronchi, increased blood volume, and increased blood to vital organs. Emotional signs include difficulty sleeping, decreased concentration, and if the stress isn't resolved, then it can lead to anxiety.
Chronic stress can cause back pain, chest pain, fatigue, hypertension, constipation, dry mouth, nausea, and weight loss or weight gain. If you have any of these signs or symptoms, acute or chronic, please go visit a healthcare physician to get some help.
Hi Salena, I'm Torri. I'll be your nurse today.
Hi, Torri.
I'm just going to be asking you a few questions pertaining to stress.
Okay. Nurse Torri asks pertinent questions to identify the patient's main stressors and current healthy or unhealthy coping mechanisms. This information will aid her in creating the best plan of action for the patient's care.
What are some common techniques that you're using for relaxation?
I like to do some yoga or watch some TV, maybe run every now and then.
Okay. Who or what is your main source of comfort?
My family, mostly.
Okay. Is there a certain person that you like to call or talk to when you need help or are feeling stressed?
My mother or my husband, I like to talk to them.
Okay. That's great. They're great people to talk to, but just so you know, if you ever do need someone else to talk to, there's plenty of support groups, centers, and even us here, we would be more than willing to talk to you.
Oh, okay.
What would you say is the greatest stress in your life right now?
Nursing school. That's pretty stressful, I would say.
Okay. I can relate. Are you currently using any drugs, alcohol, or medications to cope with stress?
No.
That's great to hear. Do you ever use comfort foods or find yourself overeating when you're stressed?
Yes. I think a lot of people do that.
Yes. Okay. Are you experiencing any of the following? Sadness, crying, fatigue, hopelessness, insomnia, or loss of appetite?
Nope.
That's good. And have you ever considered taking your life?
No.
Okay. Stress is not something to take lightly.
If you are experiencing any of the signs or symptoms we mentioned earlier, seek help as soon as possible.
If you need to call a number, you can call the suicide hotline at 1-800-784-2433.
Thank you.
Thanks.